Hello, I am Dr. Sarah Matches with the Health Science Center in Fort Worth. Thank you for watching this video on the HPV chat program, which stands for Communicating about HPV Vaccination to Adults and Teens. This video will capture the important steps to recommending the HPV vaccine to parents and patients, some of which you may already do in your own practice. This training will focus on strategies that foster an open dialogue with patients so that they can make an informed decision about cancer prevention. In this brief video, we will cover these learning objectives. First, this training aims to strengthen communication strategies and tools for HPV vaccine recommendations. Second, we aim to boost viewers' confidence in responding to parents and patient concerns about the HPV vaccine. We know that the guidelines have changed over the past decade. So let's start with a refresher of current guidelines for HPV vaccination. The HPV vaccine should be recommended to parents when children are between the ages of 11 and 12 years of age, but the vaccine can be given as early as 9 years of age. Before the age of 15, children only need 2 doses of the HPV vaccine, but at age 15 or older, they will require 3 doses to complete the series. Adults are eligible for the vaccine until age 26, and if an adult between the ages of 27 and 45 is still not vaccinated, they can engage in shared decision-making with their provider to decide if the vaccine is in their best interest. Again, our goal is to vaccinate early, between the ages of 11 and 12. Since we'll be discussing the HPV vaccine, it is vital to understand what HPV is. For starters, HPV stands for human papillomavirus. HPV is linked to several cancers, with the 2 most common cancers being cervical cancer in women and mouth and throat cancers in men. The 9-valent HPV vaccine works to protect immune systems from 9 common types of HPV, which are linked to cancer and warts. Lastly, an important takeaway is that even though someone may have already been infected with HPV, they may still benefit from vaccination. This is because the HPV vaccine protects against 9 different types of HPV viruses. HPV is the most common sexually transmitted infection in the United States. About 8 in 10 people will become infected through sexual activity. Therefore, vaccination is the best way to protect yourself from this very prevalent virus. Anyone who engages in sexual activity is at risk of being exposed to HPV. Moreover, people are often exposed within the first few years of becoming sexually active. That is why it's vital to get vaccinated early. Oftentimes, HPV infection does not cause any illness, and people will not know they have it. Your next question may be, can someone get tested to see if they have already been exposed to HPV? Well, yes and no. If a female has a current HPV infection, some cervical cancer screenings can test and identify the infection. However, for men, there is no routine HPV screening. On the other hand, if someone had been exposed to HPV in the past, there are no diagnostic tests to determine past infection. Therefore, because there is limited diagnostics for HPV infection, HPV vaccination is important. Why focus on HPV vaccinations? That's because most people will have an infection with HPV in their lifetime. We know that HPV infection can cause cervical, vulvar, vaginal, penile, anal, and oropharyngeal cancers later in life. That's 6 different types of cancer. Unfortunately, Texas has significantly fallen behind in HPV vaccination rates compared to other states and compared with other adolescent vaccines. This considerable vaccination gap indicates a missed opportunity. As of 2018, it was estimated that only about 46% of Tarrant County teens aged 13 to 17 were up to date on their HPV vaccination series. Unsurprisingly, the COVID-19 pandemic also created delays in HPV vaccination for teens, which means our work is even more critical than ever for cancer prevention. Let's take a look at strategies we can use to recommend the vaccine to patients, address their concerns, and hopefully cut down on time in clinic when having these discussions. Research indicates that this algorithm is a great guide for physicians and healthcare providers to use when recommending HPV vaccination. I will be highlighting the steps that you will use to communicate information about HPV vaccination with parents and patients in an efficient and evidence-based manner. To start, using presumptive language is vital when recommending HPV vaccination. Research has found that a presumptive recommendation is predictive of vaccine uptake for patients, meaning they are more likely to receive the vaccine. By using this strategy, you are effectively saving lives through cancer prevention. Here's a potential way to start this conversation. So, I see that John has just turned 11. Since you're here, this would be a great time for him to get those vaccines that are recommended at his age. These are Tdap, HPV, and the meningococcal vaccines. What questions do you have? It's easy to include the HPV vaccination with the other vaccines recommended at this age. After the initial recommendation, if the parent or patient is in agreement and doesn't have any questions or concerns, then it's time to vaccinate. This will be a majority of patients that you encounter. Your recommendation for the HPV vaccine is key. But we know it isn't always that straightforward for some patients. If the parent or patient expresses hesitancy or questions about vaccination, you should employ motivational interviewing skills to encourage and share information with them about the HPV vaccine. Motivational interviewing is an evidence-based approach to behavior change and works to create a collaborative environment with the parent and/or patient. This framework is a great approach to remember when communicating with parents or patients and can be applied to many topics. We will focus on the use of these skills for HPV vaccination specifically. With your presumptive recommendation for vaccination, you open the door to whatever questions the parent or patient may have so that you can hear their specific concerns. The first elicit you see here gauges the parent or patient's current knowledge and works to understand if they would like more information. It's key to ask permission to offer additional information at this step. The second step, paraphrase, helps you establish that you understand the parent or patient's concerns by echoing their concerns in your own words back to them. The second elicit seen here serves to create a dialogue with the parent or patient so that you are not controlling the conversation. After getting their approval to share, you will provide information to the parent and or patient. Topics for this part of the conversation may include things like the rationale for HPV vaccination and vaccine safety. We will go through some of these scenarios next, and you will have the option of referencing our handout that highlights key points that will be helpful in navigating these conversations. For the last step, the third elicit seeks to determine the parent or patient's comprehension of the information that they just received. Utilizing closed-loop communication will ensure they understood you and whether further information should be provided. This slide offers examples of how to navigate this conversation using motivational interviewing techniques. Let me walk you through an example. I'd start out first by providing a strong recommendation for vaccination, as previously mentioned. After this recommendation, you enter the first elicit stage by opening the door for questions by asking simply, "What questions do you have?" If the parent or patient shares some concerns or hesitancy about vaccination, summarize or paraphrase in your own words what you understand about the parent or patient's concern. After this step, then ask, "Would it be okay if I tell you what we know about HPV vaccination?" This is the second elicit stage. If the parent agrees, then I would provide information by sharing the evidence we have regarding their concerns. After sharing that information, I would elicit again where the parent or patient stands regarding HPV vaccination by using phrasing like, "Where does this leave you?" You may be wondering how best to answer common questions from parents and or patients. We will be sharing some evidence-based responses that will get right to the heart of their concerns. This information will be used in the provide step. The next part of this video addresses common concerns about HPV vaccination. These can include topics like safety, efficacy, cost, and sexual activity. There are also emerging concerns like COVID-19 vaccination. Let's take a look at some simple ways you can talk with patients during the provide step. Probably one of the biggest concerns we hear from patients is about safety. These are the stories that are often shared on social media and by word of mouth. When this concern is brought up, your emphasis that the HPV vaccine is safe is crucial. There's plenty of evidence that addresses this concern. Before approval by the Food and Drug Administration, clinical trials were conducted to ensure the safety of the HPV vaccines. Since 2006, data shows that the HPV vaccine is safe, with over 135 million doses administered in the United States alone. Shaw and colleagues developed a response that you can use, which was tested in their study and found to be acceptable by parents. This vaccine is one of the most studied medications on the market. The HPV vaccine is safe, just like the other vaccines given at this age. Another concern that often goes hand in hand with safety are the side effects of the vaccine. There's been extensive research on this aspect of the HPV vaccine as well. If we want to look more closely at any of the side effects from the HPV vaccine, we can check the Vaccine Adverse Event Reporting System, or VAERS. Reports from VAERS show that swelling, soreness, pain, dizziness, syncope, headache, and nausea are common side effects from the HPV vaccine. The reporting rate of anaphylaxis after receiving the vaccine is only 3 cases per 1 million doses. VAERS received over 16,000 adverse event reports from the HPV vaccination between 2015 and 2018. The reports showed that about 95% of the reports were categorized as non-serious adverse events, and about 5% were reported as serious adverse events. Additionally, between 2015 and 2018, the rate of adverse events reported per 100,000 doses of HPV dropped from 44.7 to 29.4. So here's that quick response for the side effect concerns. All vaccines can cause mild reactions, like a sore arm, but I wouldn't expect to see anything serious. When a parent or patient is concerned about the vaccine's effectiveness, sharing that an extensive number of studies have shown the effectiveness of HPV vaccination can work to alleviate their concerns. Reviewing these statistics can be beneficial when employing shared decision-making skills. Studies show that since the introduction of the HPV vaccines, HPV infections in the U.S. have reduced by 86% among female teenagers between the ages of 14 and 19, and by 71% among female young adults. A landmark study in the UK looked at the reduction of cervical cancer and grade 3 cervical intraepithelial neoplasia related to the age of HPV vaccination. The study showed the decrease in the rate of cervical cancer was 34% for those vaccinated between 16 and 18, 62% for those vaccinated between the ages of 14 and 16, and 87% for those vaccinated between the ages of 12 and 13. The greatest reduction in the rate of cervical cancer was found in those vaccinated at a younger age. Studies also showed a reduction in the incidence of genital warts and HPV precancers. All of that is to say that we have the evidence to respond to patient concerns with studies have shown the HPV vaccine to be very effective in reducing the number of HPV-related infections, precancers, and cancers. This is a great summary of why the HPV vaccine is important. Other concerns we hear from parents is their worry that the vaccination may make their child think that sex is okay, or that since their child is not yet sexually active, it is not important for them to be vaccinated for HPV. Again, there is plenty of evidence to support that HPV vaccination does not increase sexual activity. Studies have repeatedly highlighted that HPV vaccination is not associated with increased sexual activity or risky sexual behavior. Results from a cohort study of college-age men and women showed that HPV vaccination is not associated with increased sexual activity. Similarly, a cohort study explored the association of HPV vaccination with increased risk of sexual activity-related outcomes such as pregnancy and STIs among females between 11 and 12 years of age. This study showed that receiving the HPV vaccine did not increase the likelihood of getting pregnant or acquiring sexually transmitted infections up to 3 years after vaccination when compared to non-vaccinated patients. Finally, a systemic review to assess if getting the HPV vaccine promoted risky sexual behaviors discovered that women vaccinated for HPV engaged in fewer sexual activities, did not have multiple sexual partners, and used contraceptives when compared to unvaccinated women. With this concern, it is important to stress that HPV vaccination is about cancer prevention. Here's an example of an effective response to this concern. This really isn't about sex. The HPV vaccine is about preventing cancer, and to do so, we need to vaccinate children before they become sexually active. There is misinformation or misunderstandings regarding HPV vaccination in regards to who should receive the vaccine. Parents or patients may think only girls or women need the HPV vaccine. However, it is known that HPV can cause penile, anal, and oropharyngeal cancers in men. Studies have demonstrated that anal cancer affects over 7,000 people every year, with 91% attributed to HPV. Additionally, nearly 2/3 of penile cancers are due to an HPV infection. Interestingly, oropharyngeal cancers in men are now more common than cervical cancer in women, and approximately 71% of oropharyngeal cancers are caused by HPV. Oropharyngeal cancers are more common among men. A study on the trends of oropharyngeal cancers in the United States between 2001 and 2017 showed that 80% of the over 250,000 cases were found in men. The rate of these cancers is increasing annually in both men and women. Every year, the mortality rate for oropharyngeal cancer in men is increasing as well. So for this parent or patient concern, an emphasis on how HPV infections can cause cancers in anyone will be vital to addressing this concern. You can say, HPV infections don't care if you're a boy or a girl. The virus can cause cancer and many other diseases in both men and women. Since the HPV vaccine is mandatory for school in only a few states, it's often a topic that is brought up by parents. If the vaccine is not required for school, why does my child need to get it? You can respond to these concerns by pointing out that schools do not maintain their guidelines to match evidence-based practices. Stressing that HPV vaccination prevents cancers will be key to addressing this concern. Research shows that the vaccine is more effective when given between the ages of 9 and 12 because the child has a stronger immune response at this younger age. Because evidence indicates that the vaccine is important to deliver in adolescents, responding to this concern with school requirements don't always keep up with medical science. The HPV vaccine is an important vaccine that can prevent many cancers and is most effective when given at this age. In light of the COVID-19 pandemic, hesitation to get the HPV vaccine with the COVID-19 vaccine could stem from a safety concern or overall hesitancy about vaccines. However, studies have shown that it is safe for other vaccines to be given alongside the COVID-19 vaccine. Professional organizations such as the American Academy of Pediatrics and the American Academy of Family Physicians confirm that childhood and adolescent vaccinations can be given with the COVID-19 vaccine. To best respond to parent or patient concerns about COVID-19 vaccination, reassuring them that COVID-19 vaccines and other vaccines may safely be administered on the same day is critical for vaccine uptake. Here is language you could use. It is safe to administer the COVID-19 and other vaccines on the same day. Another thing we hear from parents who may be hesitant to vaccinate is they believe their child is too young for this kind of vaccination. Again, stressing that HPV vaccination protects their children before potential exposure will be key to addressing this concern. Additionally, if a child is younger than 15, they will only need 2 doses to complete the HPV vaccination series. Here's evidence on why waiting until later may not be the best option. Approximately 36,000 men and women have HPV-associated cancers every year. Studies show that 90% of these cancers can be prevented with HPV vaccination. A child can be protected from HPV infections when vaccinated at the appropriate age before exposure. Again, to reiterate, research shows that the vaccine is more effective when given between the ages of 9 and 12 because the child has a stronger immune response at this younger age. So to respond to that parent concern about the child being too young, you can use this response. It's important for your child to get HPV vaccine because we know that vaccinating is more effective at a younger age and they require fewer doses. Our goal is to vaccinate before the risk of exposure occurs. We completely recognize that patients have competing cost demands and may feel the economic strain. If a parent is concerned that their child is uninsured or underinsured, stressing that cost should not be a barrier to HPV vaccination is vital. Uninsured and underinsured children in Texas are covered through the Texas Vaccines for Children program. You can respond to this concern with, the Texas VFC program allows uninsured and underinsured boys and girls between the ages of 9 and 18 to have access to the HPV vaccine at no cost to them. This is where a clinic team approach is crucial, so that parents can confirm with your clinic administrators whether their child is eligible for the VFC program. I hope that this quick overview of concerns that may come up with parents or patients has been helpful. As I stated earlier, you'll have a handout that goes along with this presentation that you can refer back to if you ever need a refresher. To tie everything together, this diagram captures key points to remember when communicating with parents and patients. To review, after recommendation, you would enter the elicit stage by asking what the parent or patient already knows or needs to know. Then you would paraphrase the parent or patient's concern in your own words. Next, elicit their permission to share information to address their concern. Then you would provide information about their concern in a neutral manner, as we just reviewed. And closing out, you would elicit again by asking what the new information means to them. Here is a breakdown of the dosing schedule for adolescents and adults up to age 45. As you can see, adolescents vaccinated before age 15 only require 2 doses of the HPV vaccine. Another reason to get vaccinated early. Lastly, we recognize that you may go through these steps of recommending and motivational interviewing, and the parent or patient may still not agree to vaccination. If they decide not to get vaccinated at this time, then ask them permission to give them the HPV patient education handout. Additionally, note in their chart to follow up with them at the next visit to return to this process. This is the education handout that we created to guide your conversation with patients and parents. This can be found on our website. There will be a link and QR code at the end of this training for you to access. In addition, this handout captures main points of this training, specifically the section about answering parent and patient questions of HPV vaccination. Feel free to print it out as a resource. We hope that this is a key tool in your tool belt to promote HPV vaccination and cancer prevention for your patients. You're welcome to return to this training at any time or refer to the corresponding handout for a quick refresher if needed. You are the key to cancer prevention. Thank you so much for viewing this training. If you want to access the materials previously mentioned, scan the QR code on this slide or follow the link.